From April 11th to April 17th each year, community activists, healthcare providers, and supporters gather to discuss the ongoing issue of Black maternal mortality, this year with a focus on how the COVID-19 pandemic has only worsened racial disparities for birthing people. Reporting for the Howard University News Service, I'm Kési Felton. Black Maternal Health Week, an annual campaign created by the Black Mamas Matter Alliance, aims to amplify the national conversation and identify solutions to Black maternal mortality. According to the CDC, Black birthing people are 3 to 4 times more likely to die in childbirth than white birthing people. Black people are also more likely to face complications in childbirth, as well as throughout their pregnancy and during postpartum. Even when factors like income and education are accounted for, Black birthing people still face these disparities, and the risks only become more severe with age.
So it's got to be something else. It's got to be other factors. And what a lot of studies are showing is that, the stress of, that Black women and other communities are facing and how that is impacting us physically. And some of that is coming out in our maternal health outcomes.
And although the decision of if, when, and how to have children is personal, community organizers as well as policymakers are working to support rather than hinder that journey. The Black Maternal Health Caucus, chaired by U.S. Representatives Lauren Underwood of Illinois and Alma Adams of North Carolina, introduced 12 pieces of legislation known as the Black Maternal Health Omnibus Act of 2021 in February. The bill most notably aims to address the social determinants of health that impact maternal outcomes. Bachelor specifically highlighted climate change, mental health, transportation, parental leave, and food access as key factors addressed by the bill.
Legislation. It's 12 different bills that have been introduced separately, but also have been combined to create this larger piece of legislation that really does speak to, specifically as a reproductive justice advocate, speak to the whole lived experience.
The Omnibus Act also calls for an investment in community programs, as well as in doulas and midwives, who have shown to significantly improve maternal health outcomes, especially for Black birthing people. Kia Donald, a doula and mother, shared her experience.
I think between being a doula and being a mother, there's like a switch that gets turned on in your brain where all of a sudden you're like, oh my gosh, there's so many things I just didn't realize before. And so being able to better connect, I think, with other women is definitely one of the key takeaways. Another, though, is recognizing my own birth trauma.
Donald, now expecting her second child, also shared that she's currently working on a documentary with other doulas to further highlight Black maternal experiences.
That you search Black maternal health, you search Black women birthing or anything, and it's always going to be negative. And so wanting to try to find a way to, yes, tell the truth, but also tell the whole truth, meaning that a lot of this experience is joyful as well. And we take a lot of that away when we pound Black mothers with all of these truths that really are mainly for other people to recognize that what they're doing is wrong.
Reporting for the Howard University News Service, I'm Kési Felton.